So viruses are the last pathogen that we're going to talk about. These are simple microorganisms that don't possess any of the organelles that the other ones do. And their basic viral structure consists of nucleic acid that are protected by an envelope of protein called the capsid. And they come in many different shapes. And they also they may have also another protective enzyme envelope with the plasma membrane as well, even around the capsid. And viruses are basically live off the host. They are parasites, and they infect the individual either directly or through an animal reservoir. Human-to-human transmission can come through sexually, through the blood, or through respiratory fluids. And basically they interact and attach to the cell membrane very specifically with receptors. And so for instance, the HIV virus has a glucoprotein that attaches very directly to the CD4 cells. And once bound, they penetrate the plasma membrane in a variety of ways. They can either through endocytosis develop an envelope that fuses with the plasma membrane and envelops the contents, or they can directly enter the plasma membrane of the cell. And once they're within the cytoplasm, they uncoat their capsid and release their genetic material. They can become they can be either DNA or RNA transmitted. If they're RNA, they produce messenger RNA, which translates into very specific viral proteins. And if they're DNA, then they usually, like for instance HIV, carry an enzyme reverse transcriptase, which creates a double-stranded DNA version of the virus. It enters the cell nucleus and becomes incorporated into the host's DNA. Viruses cause many harmful effects. They inhibit DNA, RNA, and protein synthesis. They can disrupt the lysosomal membrane. They can promote cell apoptosis. They can fuse with adjacent cells and increase in terms of their viral spread. They can transfer them to cancer cells, and they can also alter their cell membrane properties and become more antigenic. One example of the virus that we want to go into in more detail is the HIV virus that causes AIDS. And essentially HIV is a fragile virus. It can only be transmitted under certain conditions, like contact with infected fluids that includes blood, semen, or vaginal secretions or breast milk. And so basically it was a ribonucleic acid RNA virus that was discovered in the 1980s. And it's called a retrovirus because it replicates backwards in a backwards manner from RNA to the DNA. And like other viruses, HIV can't replicate unless it's inside a cell. And it enters the cell through these GP120 knobs, they're called, on the viral envelope. And these knobs combine or fuse with specific CD4 and chemokine receptor sites on the cell surface. Chemokine receptors are proteins normally found in the cell membrane that respond to chemokines outside the cell to trigger a response inside the cell. And HIV uses different receptors, CD4 being the main receptor, to make binding and entry into the CD4 T cells possible. And once bound, the viral RNA enters the cell where it's transcribed into a single strand of viral DNA with the assistance of this enzyme, reverse transcriptase. that is an enzyme made by retroviruses. And this strand copies itself, becoming a double-strand viral DNA, which enters the cell nucleus and becomes another enzyme called integrase, which splits itself into the genome, becoming a permanent part of the cell's genetic structure. And there are two consequences of this particular action. First, it becomes all the genetic material is replaced during cell division, and the daughter cells also become infected, and so on and so forth. And viral DNA in the genome will direct the cell to make all new HIV virus. So HIV production in the cell starts with long strands of HIV RNA and is cut up into appropriate lengths by the enzyme protease during the budding sequence. HIV virus uses the budding then to multiply and create new cells, and it makes these millions of copies into the bloodstream and attaches to a new CD4 cell to start the process all over again. The HIV infectious process takes three forms: immunodeficiency, autoimmunity, or neurologic dysfunction. The immunodeficiency includes the opportunistic infections that occur for the individual. The autoimmunity aspect includes the lymphoid tissues, arthritis, pneumonia that develop, and the neurologic dysfunction is the dementia complex, encephalopathy, and the peripheral neuropathies that occur. The patient may be asymptomatic for quite a few years, but once infected and starting to show symptoms as a result of opportunistic infections, they may have a brief period of flu-like symptoms and referred to as the acute retroviral syndrome. And then after this, they may remain asymptomatic for months, if not years. And as more CD4 cells are destroyed, the patient then begins to have symptoms. Diarrhea, weight loss, fever, cough, shortness of breath, and becomes more symptomatic as more CD4 cells are destroyed. And over the next 10 years, serious clinical manifestations then start to appear. Basically, HIV in children appear differently in terms of its progression. They may experience weight gain and difficulty gaining weight as well. Children may have difficulty growing normally, trouble walking, delayed mental development, and as well as other developmental delays, and serious childhood illnesses such as ear infection, pneumonia, tonsillitis. Basically, there's different diagnostic tests that can be done. Diagnosis used to be with just long-term tests, but can be done as early as 1 month after exposure. And we used to use the enzyme-linked immunosorbent assay and the Western blot test, and those took quite a bit of time to get the results. But now we have several rapid tests that can be highly accurate within as little as 20 minutes. Basically, these tests look at the antibodies to the virus using blood or fluid samples. They can be, you can get a pad, a treated pad that's rubbed on the upper and lower gums, and this oral test is about as sensitive as the blood test. And a positive reaction usually requires the blood test, though, to confirm the diagnosis. And these are relatively new. You can get them for home use. The one that we have, though, rather than like a home pregnancy test, you mail it in, and then the result are retrieved in about 3 to 7 business days by calling an 800 number. And that ensures the privacy and the anonymity of the patients. And then all positive results you would get retested. And then, of course, you've got the laboratory assessments, the CD4 and the CD4 and T cell counts, and the viral load. The T cell counts provide a marker for the immune function, and as the disease progresses, the CD4 cell counts can get pretty low. Normally they're 800 to 1200 cells and are considered normal, but usually some with HIV is at or below 200 cells. And essentially the viral load looks at the number of viral particles per milliliter of the blood, and is indicated the higher the viral load, the more virulent the disease is, the further the progression. And this would be an appropriate test for infants because of the mother's. So diagnostic tests of the virus for the infants, because of the mother's transferring antibodies to the infant's, diagnostic testing is usually delayed up to about 18 months. There is the test for the viral load, though, that can be done for the infants as well. The viral load can be an indication of treatment success, how they're doing with the different treatments. Treatment of for the adult is antiviral therapy, and usually they get 3 or more drugs, and it doesn't cure the patient, but it slows the progression. Treatment for the child is more aggressive and more symptom relief, and so they also have different symptoms for the virus. The central nervous system is more vulnerable, so you see more intellectual losses, developmental delays, impaired brain growth, microcephaly, and motor deficits in the child. They often use the antiretroviral therapy as well. Drug therapy for AIDS is pretty difficult because, like most retroviruses, the AIDS virus incorporates itself into the genetic material of the host and never can be removed by antimicrobial therapy. And drug administration to control the virus may need to be continued for the lifetime of the individual. There are genetic tests, though, that are now available to determine whether the particular therapy is, and the HIV strain is resistant to a particular drug, and can help in terms of determining which drug would be helpful. To wrap up, there are different ways to control infection. We have numerous chemicals like antimicrobials that block the DNA or the protein synthesis or inhibit the production of the cell wall. And they act by preventing the function of enzymes or cell structures that are unique to the infecting agent. Then you have different antivirals that interfere with the folic acid metabolism, and they're successful since, so they're limited in terms of their success because they incorporate themselves into the host enzymes themselves and the person's DNA. And then you have vaccines that prevent disease, but actually the immunity that the body offers, that they build up to the infectious disease, is better. And of course you need many boosters to help the vaccine along. Basically, the purpose of vaccination is to induce active immunological protection before exposure to the infectious agent. And most vaccines against viral infections contain live viruses or accentuated viruses like polio. And then you have some of the vaccines that are the killed microantigens or the viruses, like I said, like polio. And then you have bacterial vaccines that are conjugated, like your hepatitis B vaccine. And this means that they put several proteins together to make the vaccine. And then you have passive immunity that give the patient preformed antibodies like the Hep A or B vaccine.